Picture this moment. You've just finished dinner. The dishes are done, the table is cleared, and you have a small window of time before the rest of your evening takes over. Maybe it's 20 minutes. Maybe, on a whim, you decide to give yourself 40. From the outside, both choices look almost identical. You lace up the same shoes, you walk out the same front door, you move through the same neighborhood streets under the same sky. No gym dag, no heart rate monitor beeping at your wrist, no burning lungs or sweat soaking through your shirt. Just movement. Quiet, unhurried, ordinary movement. And that's exactly why most people never suspect that those two walks are doing fundamentally different things inside their bodies. This isn't a story about effort. It isn't about pace, willpower, or how many steps register on your phone. This is about something most people have never been told, that duration, not intensity, is the variable that visceral fat actually responds to. And once you understand why, the way you think about walking will never quite be the same.
Let's pause time mid-walk and look inside your abdomen at the 20-minute mark. What would we find? Would your visceral fat be releasing stored energy, cooperating with your movement, beginning to loosen its grip? Or would it still be quietly holding on, cautious, unconvinced, waiting for more information before it commits to anything? Most people never ask that question because most people assume fat loss is linear, that if 20 minutes is useful, 40 minutes is just double the benefit, twice the steps, twice the calories, twice the result, clean, proportional, simple. But visceral fat doesn't work like a fuel gauge that empties as you move. It works more like a security system, sophisticated, reactive, and deeply resistant to releasing what it holds unless the conditions feel right. And understanding that one distinction changes everything about how you approach your daily walks.
This is why visceral fat is different from the fat you can pinch beneath your skin. Subcutaneous fat, the kind that sits just under the surface, is relatively passive. It responds to a calorie deficit over time and releases energy in a fairly predictable way. Visceral fat is something else entirely. It wraps around your liver, your kidneys, your intestines, sitting directly alongside the organs that keep you alive. It is biologically wired to be protective, cautious, and highly sensitive to the signals coming from your nervous system, your hormones, and your blood. It doesn't release energy freely. It waits, it monitors, it evaluates whether the current moment is safe enough to let go. This is why visceral fat is so strongly associated with insulin resistance, elevated cardiovascular risk, and metabolic dysfunction, even in people who don't appear overweight from the outside. You can carry significant visceral fat without it changing how your clothes fit. It accumulates quietly, responds to stress and diet and inactivity, and communicates constantly with the rest of your body in ways that most of us never feel consciously.
And this is why walking, calm, steady, unhurried walking, can be one of the most powerful tools for reaching it. Not because walking is intense, but because visceral fat doesn't respond to intensity the way your muscles do. It responds to environment. It responds to sustained signals that tell it, over and over again, that energy is being used in a controlled way, that the body is not under threat, that it is safe to participate. To understand how that signal gets built, we need to follow what actually happens inside your body from the moment you take your first step. The internal clock starts the second you begin moving. In the first minute or two, your muscles make a modest request, a little more oxygen, a slightly increased blood supply. Nothing urgent, nothing alarming, just a quiet signal that the body is no longer at rest. Your nervous system registers this and makes a small adjustment, shifting out of its idle state and into something slightly more engaged. Your heart responds accordingly, beating a touch faster, pushing blood with a little more purpose.
As blood flow increases, something remarkable happens inside the walls of your blood vessels. The inner lining, a thin living layer called the endothelium,
senses the increased flow of blood brushing against it, and it responds. It releases nitric oxide and other relaxing signals that encourage the vessels to widen and soften. Resistance drops. Circulation becomes smoother and more efficient. Your heart doesn't have to work as hard to push blood through the system because the system itself is becoming more cooperative. But here's what's crucial to understand in these early minutes. Visceral fat is not being burned. Not yet. What's happening in this phase is preparation. Your body is reducing friction, improving flow, and gathering information. It's asking a quiet but important question. Is this a brief interruption to rest, or is this the beginning of something sustained? As you move into the 3 to 10 minute range, the internal shift becomes more pronounced, even though you still feel almost nothing unusual. Your breathing changes rhythm. Inhales deepen slightly. Exhales become more complete. This isn't random. This breathing pattern feeds directly back into your nervous system, nudging it away from its default alert state and towards something calmer and more balanced. Stress signals begin to soften. Not vanish, but loosen, like a fist that isn't quite as tightly clenched. And then you reach small pauses, becoming more flexible in real time. Muscles start pulling glucose in more efficiently, which means the body needs less insulin to manage blood sugar. The rigid, reactive hormonal environment that keeps visceral fat locked starts to ease, just slightly. The conditions are improving. The message is beginning to land. And then you reach 20 minutes. This is the moment most people stop. And from a general health perspective, that's not wrong. A 20-minute walk is genuinely valuable. It supports cardiovascular health, clears the mind, reduces stress hormones modestly, and improves blood sugar management. There is real benefit here, and anyone who dismisses it is missing the point. But from the specific perspective of visceral fat, 20 minutes is still a transitional phase. For people who carry significant stress, who have developed some degree of insulin resistance, or who spend most of their day sedentary, the internal environment at minute 20 may not have settled enough. Cortisol, the stress hormone that tells your body to conserve and protect, may still be elevated. Insulin patterns may not have fully stabilized. Visceral fat, sensing that the environment hasn't fully committed to safety, remains cautious.
At 20 minutes, your body is saying, "I hear you, I'm listening, but I'm not convinced yet." The signal has been received, but it hasn't been sustained long enough to feel trustworthy. The conversation has started, but it hasn't reached a conclusion. This is why so many people walk faithfully every day, 20 minutes without fail, and still find that their belly fat doesn't budge. They are doing something real and meaningful, but they may not be staying in the right biological state long enough for visceral fat to receive the full message. When you keep walking past that 20-minute threshold, something measurably different begins to happen. Cortisol, rather than hovering in that uncertain middle zone, starts to decline more decisively. Insulin signaling becomes steadier. Blood flow remains elevated long enough for the hormonal environment to genuinely shift rather than just flicker. The body is no longer evaluating whether this effort is worth responding to. It's adapting to it in real time.
As you move through the 30-minute mark and approach 40 minutes, your body has now spent an uninterrupted stretch of time in a low-stress, well-regulated metabolic state, and visceral fat begins to sense that the environment around it has changed. Blood vessels are open and flowing smoothly. The nervous system has stepped back from its alert posture. Insulin is no longer spiking. The constant signal to store and protect has quieted down enough that something new becomes possible. Visceral fat cells begin releasing fatty acids more freely into circulation, not in a dramatic surge you could feel or measure in the moment, but in a quiet, meaningful shift in how the body is sourcing its fuel. It transitions away from relying primarily on circulating glucose and begins drawing more from stored energy, not because you forced it, not because you burned through your glycogen reserves, but because you stayed long enough in the right conditions for the body to decide it was safe to let go. This is the core biological distinction between a 20-minute walk and a 40-minute walk. 20 minutes initiates the process. 40 minutes completes the message. One duration tells the body that movement is happening. The other tells the body that movement is something it can trust.
Add small pauses between key ideas. Use a story lover's excitement, but keep it smooth and professional. Emphasize numbers, specs, and features with enthusiasm. Slight dramatic buildup before important lines. Keep the tone warm, confident, and knowledgeable. No shouting. Excitement should feel like a real gearhead talking to another gearhead. Pace matters here, but only within a reasonable range. You don't need to walk fast. You don't need to push yourself into discomfort or breathe heavily. A steady, slightly brisk rhythm, the kind where you could hold a conversation but wouldn't want to sing, tends to reinforce exactly the right signals. Too slow, and the stimulus may not be sufficient to trigger meaningful vascular and hormonal responses. Too intense, and you risk raising cortisol again, which can counteract the very environment you're trying to build. The goal isn't exertion. The goal is a rhythm your body learns to trust. Now, here's where timing adds another layer to this entire picture, because there are specific windows when a 40-minute walk becomes even more powerful, windows most people either don't know about or don't take advantage of. The first is after eating. When you finish a meal, your blood sugar rises and insulin increases to shuttle that glucose into cells. From your body's perspective, this is a storage-oriented window. Energy has arrived, the system is in receiving mode, and visceral fat interprets this as a reason to stay protective and still. Sitting down after eating reinforces that message completely. Blood flow stays low in working muscles, insulin remains elevated, and the body receives the same signal repeatedly. Store, hold, protect.
A 20-minute walk after a meal does help. It redirects blood flow toward working muscles, encourages glucose uptake without demanding as much insulin, and softens the blood sugar spike. For many people, especially those managing insulin resistance or metabolic syndrome, this is genuinely meaningful. But for the same reasons we've been discussing, 20 minutes may only interrupt the storage process rather than fully redirect it. A 40-minute walk after eating extends that interruption into a genuine transition. Insulin has more time to settle. Muscles continue drawing on incoming fuel. Blood vessels stay open and responsive far longer. The body receives a clear, sustained signal that shifts it away from pure storage mode and toward metabolic balance. Over weeks and months, this cumulatively changes how often visceral fat gets reinforced as the body's default energy reserve. The second powerful window is after stress. When you experience psychological or emotional stress, a difficult conversation, a demanding afternoon at work, an anxious evening, cortisol rises and instructs your body to keep energy close, particularly around vital organs. Sitting still while stressed allows that signal to linger unchallenged. The tension doesn't leave, it settles in.
This is short walk after stress can take the edge off. You know this feeling intuitively. A quick walk around the block clears your head a little. But a longer, steadier walk does something physiologically distinct. It gives your nervous system enough uninterrupted time to fully step out of alert mode rather than just pausing it. Cortisol falls more meaningfully. The body receives a clear signal that whatever the threat was, it has passed. The system can exhale, not just briefly catch its breath. This is why longer walks after stressful parts of the day often feel qualitatively different from shorter ones. The relief isn't just psychological. The physiology has actually shifted. The body has had enough time to reset rather than merely pause. Clinicians who track these changes over time don't just look at weight on a scale. They look at waist circumference measurements that begin to shrink even when overall weight stays relatively stable. They see fasting insulin levels improving, blood pressure becoming steadier, recovery after exertion becoming faster and more complete. People sleep more deeply, feel less reactive during the day, notice that demanding situations don't wind them up the way they used to. These are the fingerprints of a changing metabolic environment, not just a changing energy balance.
And this is what makes the longer walk quietly revolutionary for so many people who try it. They don't change their pace. They don't overhaul their diet. They don't add a second workout to their week. They simply extend what they were already doing by 20 minutes. And the body, finally receiving a signal long enough and clear enough to act on, begins to respond differently. Over time, repeating this pattern rewires the system more deeply. Blood vessels become more elastic as a baseline. Hormonal responses to stress and food become less exaggerated and more measured. The nervous system learns to downregulate more readily. Visceral fat, no longer perpetually on guard and no longer being repeatedly reinforced by elevated cortisol and insulin, gradually loses its biological reason to stay tightly held. It doesn't disappear overnight, but it begins to release its grip in a way that shorter, more inconsistent movement patterns never quite achieve. Before we close, one thing needs to be said plainly. Walking is among the safest forms of movement that exists, but anyone experiencing chest discomfort, dizziness, unusual breathlessness, or who has known heart disease, uncontrolled blood pressure, or is recovering from surgery or illness should speak with a doctor before extending their movement routine. This is not about pushing through warning signs. It is about building a pattern that your body can adapt to and benefit from safely, over time, without damage. We started with a simple image. 2 walks, 2 choices, almost identical from the outside. Now you can see what separates them on the inside. It was never about effort. It was never about discipline or fitness level or how hard you were willing to push. It was about duration. It was about giving your body enough uninterrupted time in the right biological state for visceral fat to stop protecting itself and start letting go. 20 minutes starts a conversation. 40 minutes changes what the body decides. The people who walk every day without seeing change in their belly fat aren't failing. They may simply be stopping just before the threshold where the body stops evaluating and starts responding. And the people who extend their walks without changing anything else, same pace, same route, same shoes, and suddenly begin to notice a shift, they didn't work harder. They stayed longer. And their body, finally receiving the full message, changed its mind.